I'm Dr. Wong Boy. Actually, I'm a parent club founder. I handhelp the parents through the journey from pregnancy to delivery to postnatal. But because I built a very strong rapport, I have often all the parents, even up to very many years older, even up to 16 years old, parents still actually get in touch with me with some advices, especially on skin rash and allergies and things like that. So I work very closely with the doctor. I may give them advice, but if I feel with years experience, I'll say to them, go and see your doctor, and then it's better to further confirm. So that's important because we work as a team. One in 5 children got asthmatic attack in Singapore, but when they're under 5 years old, we cannot diagnose them, especially the pediatrician will treat the symptoms, but they will not diagnose them as asthma. And actually, after 5 years old, then they only able to confirm it's asthmatic attack. What does it mean? Because actually the airway itself, the bronchial and the trachea itself is inflamed. And when it's inflamed, they're caused by, maybe even simple air, inhale in some of the smoke or some of the even mold in the house and things like that. And the baby the bronchial go into spasm. It gives out a little bit of wheezing sound. Baby have difficulty to breathe, and it's more scary for the parents rather than the child. So what we have to do is very important is, refer them to a specialist or a pediatrician to have a proper management. So in severe cases for newborn baby, usually they'll use a bit of nebulizer, easier to do with younger children. Older children, of course, they can take, the inhaler and things like that. So there is a various form of medication they can use, and they're called a bronchodilator. They just help to relax, and then calm the child down. Yes. Most of the children actually, as they go into adolescence, they seem to become better. My own son was asthmatic anyway, but as he grow older, usually they will actually just grow out of it. But in certain cases, there are some cases it comes on and off. But if you're able to manage it properly long term, with your pediatrician, work closely, and usually most of them are under control in severe cases. Certain food, I think, can trigger off, like anything that child is sensitive to. Even food can cause the airway to narrow and swollen up and inflame, and because of this, it can also trigger off. So the wheezing and it may even trigger off the cough as well. It makes it very uncomfortable and frightening for especially younger kids. The food the child is well known to allergic to, it's better to avoid it. Or we give them in smaller amount, they may outgrow it. So like an oral tolerance, just a small amount to test it out and gradually increase the amount. So the child may outgrow it as well. Goat's milk, by research, they say that it's less allergy. So when talk about the growth status to be similar to other form of milk, so therefore the only thing the difference is the baby's poop. Actually, the bowel action is much better, it's softer and easier to pass, and that is the difference. Most of the time, compared to other form of formula, the composition almost similar, except the MCT, and they found that it's slightly, higher in content in goat's milk.